Hi, my name is Sam Robinson. I work for the Social Research and Evaluation Center at Louisiana State University, and we are working with the Louisiana Office of Behavioral Health to develop a system for collecting data for the State Opioid Response Grant. This video is aimed at members of the crisis mobile teams for this grant, who are going to be required to enter some data into this system for the purpose of reporting out to the Office of Behavioral Health certain activities being undertaken as part of the grant. There's another video that will be shared with you that will cover most of the information that you can see here on the screen. The drop box information, Narcan distribution and education activities, safe storage and disposal, trainings attended, and events and other activities attended and presented. This video is going to cover really two pieces of information, though, that only apply to the crisis mobile team and do not apply to others who are working on projects as part of the State Opioid Response Grant. And these two pieces of information are, first, client information, and secondly, referral information that's associated with the client information. So I'll walk through these a bit in turn and explain how to enter this information into the system, what this information should look like, and so I'll go ahead and start that now. When you log into the dashboard for the crisis mobile team, you'll see a screen that looks like this, or something that looks similar to this. The reason I say that is because there are two tiers of users who have access to this system that we're calling the SREC, which is the acronym for our unit, the Social Research and Evaluation Center. We call this the SREC Data Hub. And when you log into this system, the SREC Data Hub, there are two dashboards for people who are on crisis mobile teams. This is at the request of the Office of Behavioral Health, who wanted to give different privileges and access to different types of users. So the screen that you see here actually is for people who are supervisors with the crisis mobile team. And the only difference between that and the other dashboard, which is for crisis mobile team members, is that there's this section here at the bottom that for supervisors you can't only view, you can also edit information that's been previously entered and delete information. Whereas if you're a member of the regular team member login, you'll only be able to view information. I'll explain this in a little more detail later, but this is just as sort of a preliminary heads up. But this information at the top should be exactly the same for all users from Crisis Mobile Team, no matter what your status is. And again, the piece that we're going to be talking about today is this Add Client Information form and associated referral information that you'll get to once you go through this system. So in order to use this system, the first thing you have to do is log in. So I'm going to log out here and just show you how to log in. I've got a test email and password here. This isn't a real one. You will be sent usernames and email addresses and passwords through email. And then when you get that, you'll be able to enter this information for your own site. You sign in. We'll send you the link, of course, and here you'll be able to see this information. Members of the supervisor dashboard and those who also have access to the regular team dashboard will use the same primary link to get to this page, but once you log in, it will show you different kinds of information depending on your privileges. So once you come in here, you'll see that there's these two sections, data entry and view/edit history, or just view history. And what we're talking about again, data entry, add client information. This is the one we're focusing on. So you come here, you just click into this button. So before we get into the details of what you'll do entering information into this form, I'll explain a bit about what this information is supposed to include. And so basically, and probably intuitively to most of you, this will be the clients that you see as part of your activities for the crisis mobile team. For whatever reason, when you see individuals as part of this team, you'll come in and enter their information here. I believe in previous grants, you may, if you had been working on this, the Office of Behavioral Health may have had a similar kind of process where data may have been entered into maybe Microsoft Excel, but this is a little more refined version of that, where you'll be able to enter information into this system. And the system has a few benefits, by the way. And going back to the first page, you can see because you can both enter and view his information, you can use this system not only to ensure that you're following required grant reporting pieces, which is the data entry, but also you can use this to sort of monitor your own information. Be able to track the data that you're inputting into the system to help you manage your own programmatic activities. So it can serve as these dual kinds of functions. So coming back here, add client information. I'm just going to walk through some of these fields where, in particular, some of them may not be as intuitive as some others. We have created some written guidance. This written guidance will be sent to you. If you have questions, I would encourage you all to read through that information. We try to explain in some level of detail how this system works. Nothing we talk about here today in this video should be very surprising or very different from what's into that written manual. This is maybe just a little more user-friendly, and maybe something that would be a nice way of supplementing what you see in the written manual if something doesn't perhaps make as much sense. So the first field here says LGE type, and if you select it, you're only going to see an option that applies to your site. This one says Region 1, and the reason it says that is just because that was the region that was set up for test purposes. But yours will be whatever region you're affiliated with. And understanding that some crisis mobile teams may work directly for the LGEs, while some others may not, what this really is meant to say is this is the region, the LGE region that you're servicing. So even if you don't work directly for the LGE, you'll select the one that's covering the region that you do work in here. So if you worked in East Baton Rouge, but you weren't working directly for Capital Area Human Services, you would still select that one as your option. That's the only one you'll see. And you do have to select this. One thing you'll see is a number of these indicators have these little red asterisks here. And when you see the red asterisks, it means it's a required field. This field is required, even though it's going to be the same information every time and you don't have any variability. You need to select this option. It's just the nature of the system, the way we had to set up the system to develop all the functionality that we wanted. We had to build this field in. So just go in and select that every time, just as a click. It doesn't take a lot of work. Second is client ID. And this is something that is worth spending a couple of minutes talking about. If you look in the written guidance manual, we explain in some detail how you should develop your own client ID. And this is a 15-digit code that the Office of Behavioral Health has developed, similar to client IDs that they've used in other programs and for different purposes. And the client ID includes a number of different characteristics. The first 3 digits will be the number of the client, really in the order in which you see them at your site, or in this case for your team. So if it's the first client you see, it would be 001. Next, you'll have a 2-digit or two values that go into your ID that refers to your specific site. And the second part of this this code will be the letter D. The first will be a number, and in the written manual there's actually a table that will list what the code for your crisis mobile team is. So I believe Capital Area, I mentioned before, was this number 2. I believe Metropolitan, which I've got here, is number 1. I think they're associated with the regions, Region 1, Region 2. But look at that table to make sure. So assuming that this one is 1D, I would put 1D. So again, it's client number 001. The site code is 1D. Next, you'll enter a date, an 8-digit date field, which will be recorded as 2 2 values for month, 2 for date, and then 4 for year. So today, as I write this, it's September the 18th, so I would say 09 for September, 18 for 18, 2019. And so now we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. We're only 2 away. The last pieces of this is the number 23. And 23 is a 2-digit code that refers to the state opioid response grant. So every single client that you enter into this system as part of this grant will have a number 23 at the end. So again, 001, first client, 1D, site code, 9/18/2019. This is not only today's date, it's the first date that you see a client. So understanding it's a client ID, if you see them 5, 6, 7 times, however often, they'll keep the same client ID. And so you're going to have to be able to keep track of what their ID is and referencing that first time they're seen by your team each time, as that feeds into the client ID. So you'll want basically a lookup key that you maintain on your own that has maybe the client's name and the client's ID. So if they come back, if they get re-referred, or if you have a follow-up visit, if they decide to come back on their own, you'll know what that value is. Otherwise, they'll be recorded more than once, and that will mess up the data a bit. Then finally, 23 for the SOR grant. So that's just an illustration of how client ID will work. Gender, you choose the gender. It's just to select one of these options here. Age is a numerical field. Race, ethnicity, you can choose multiple of these. So in particular, if you have, for example, someone who's both African American and Asian, you can enter that into those fields. Or if they're Hispanic Latino, Hispanic Latino being ethnicity, not a race, you may often have a situation where you cross-reference that with other fields. Oftentimes you will see, by the way, this client refused to answer option, and if for whatever reason they refuse to answer, you can go ahead and select that, or you can select none of the above if there's an option that doesn't fit in here. Zip code of the client interaction, so wherever the interaction takes place, the zip code, so we can track where these interactions are taking place. The location of the activity, this would be a physical location, so it could be a street address, it could be a building, some kind of business or organization. However it makes most sense for you to describe the location within the zip code. Next question is about residents. Who do they live with? So here you can select, of course, multiple options as well. Pretty straightforward. Tribal affiliation, whether they're associated with a nationally recognized tribe or state recognized tribe or whatever kind of tribe the client may affiliate themselves with. You can enter that here. This is a required field. So if there's no tribal affiliation, you can just do N/A for not applicable. And when I say required field, what that means is if you go down to the bottom and try to submit this form, you'll find that the form will not allow you to submit this unless you choose an option for each required field. So that's certainly the case here. You'll have to put not applicable if there's no tribe that they're affiliated with. New case follow-up or re-referral. This has implications further below for a later section, but this is also just to allow supervisors and people at the Office of Behavioral Health and for yourselves to say, okay, well, is this a new case or isn't it? And if it's not a new case, is it a follow-up, meaning that you scheduled essentially a follow-up with this client, or is it a re-referral where they're referred to you from someone else? Or even if they came in on their own, that's essentially, we'll consider that a re-referral for this purpose, to say they kind of referred themselves back to see you again. And then the date of screenings, this will auto-populate to today's date, so you can change that if you need to. A calendar will appear when you click in there, and you can put another date if you need to. If you say you don't get to enter the information into the system for a couple days, though the easiest way to enter this information would be to do it as the client's there with you, because you can see there's a lot of information here. and it might be difficult to try and collect all of this alternatively through some other means. And Office of Behavioral Health has let us know that you all should essentially have access to the web for entering information when you see clients. So that would just make the most sense here. Client history, straightforward. If the client has a history of any of these things, you can enter these choices. You will notice that if you choose other, and this is something that's a recurring theme through this form, a new field will appear. It says enter other information about client history. So if there's something else missing here, you can click this other option and then enter this information here. If you don't, it goes away. And one thing about this too is it does have an asterisk here, meaning it's a required field, but these hidden fields are only required if you select the option before it that makes the hidden field appear. So if you don't select other, you don't have to answer it. It's not going to force you to answer it. But if you do click other, then you have to enter in what the other information is in order to satisfy the requirements of the form. Next is a question, is there a current mental health diagnosis? Yes, no, client refused. Then we have select all that apply in terms of mental health, whether they're a risk of harm to self, depression, family conflict, etc. Other, click that again. This new field will appear. Client refused, none of the above. And and then you should ask the client, are they interested in help or resources for any of the issues outlined here? If there are, they'll select yes, and then a new drop-down box will appear. Really, these are sort of different options you can pick from. And you can pick multiple of these. And again, this is the one that will be a required field if it appears. If it doesn't, you won't have to answer it. Okay? So to say that depression and anxiety were issues, and then they want help with just depression, you would select these two, select yes, and then select depression here. Physical health, similarly to the mental health, it actually works pretty much the same way. You just select the ones that apply, say yes, no, or client refused, and then which ones they might want help with. Alcohol, drug, and tobacco. There's a similar kind of function here, but it's a little bit different than the prior two sections, so we'll describe that. First, you ask them if they're using opioids currently, yes, no, or client refused. And that's relevant for this grant because it is a grant focused on opioids in particular. Then there's a question about whether there's a current substance abuse diagnosis. So you saw before, is there a current mental health diagnosis? There's a parallel here for substance abuse. Then you can choose all that apply here. Now, how this is different than the other fields is you see every time you select one, a new question appears at the bottom, where if you say they've used marijuana and methamphetamines, then you're going to have questions appear that says, when was the last time that these substances were used? And you have to select one of these options. The last time is within the last 30 days, within the last 6 months, within the last year, over a year ago, none of the above, or client refused to answer. And so just select the option there. And then, as with the mental health and physical health sections, they'll ask, are you interested in help or resources? If you select yes, then you can select the ones that apply. Okay? Follow-up information. So this is something that I mentioned earlier was relevant based on your answer to question, I believe, 10. So by putting referral here, this section appears. But if I go up here and I click, it's a new case, and then I go back down, you see that information is now gone. But if I click yes, the client had previously been seen, it reappears again. Really, this answer should be yes every time one of your answers to question 10 is follow-up or referral. That suggests you've seen them before. So those you should always be correlated. And then, but by clicking one of those answers above, or by clicking yes here, these new questions will appear that are going to ask you questions about, based on the fact that this is a follow-up or a re-referral. So these questions are how many times the client previously seen, and then it's going to have 3 questions about the status change of the client. The first is OUD, so opioid use disorder status change. The second is behavioral health status change. The third is overall status change. And the options are the same in each of these. It's significant decline, modest decline, no change, modest improvement, significant improvement. And the assumption here again is because you've seen them more than once, you should be able to witness whether or not there's been change and to what extent change has taken place in a positive or negative fashion. So since that you say you've seen them 3 times, and it asks about since your last encounter, so the second time they came in, you probably would have already entered in this information. Here you enter it again. Since the second time you saw them, so there was a modest decline in OUD status change. I mean, they're getting a little bit worse. But maybe their behavioral status change is no change. And maybe their overall status change is also maybe modest decline because of the OUD status change. This should be able to facilitate your programmatic activities because it can help you to make a good assessment of the extent to which the client has made change, and it's documented here. So this is basic information associated with follow-ups or re-referrals. Next, there are a number of questions about Narcan. Has the patient ever overdosed? Yes, no, client refused. Has there been a Narcan overdose reversal? Has a Narcan kit been distributed to the client while you're seeing them? So that would be a yes or no. And then, are you providing individual Narcan education to the client? So these last 2 questions are really about what happens while you see the client. The first 2 are about historical information associated with the client. Very straightforward. These 2 don't have a client refuse to answer because it's just whether you do it or whether you don't do it. These are you're asking the client a question. Or perhaps you already know from your history, having seen them before, in which case maybe you already know the answer. Brief intervention. 27 is was a brief intervention provided. And if it was, you click yes. If it wasn't, you click no. So the SREC process, screening, brief intervention, referral to treatment. If a brief intervention kind of aspect and component was provided, you'd click yes here. Finally, we ask near the bottom of the screen, which member or members of the team saw the client? And so we've got the 3 primary members of the crisis mobile team: nurse, licensed mental health professional, peer support specialist, or none of the above. And you can select as many or as few as you need to. Finally, there's a question about referrals out made. And this is the part that's going to get us to another forum here in a second. So it's important to understand this is not a referral being made to you. It's a referral being made out by you to another provider. If that happens, if you refer the client out to another kind of provider or someone else, you would click yes. If no, you click no. But I'm going to click yes here so that we can go and show you what happens in the next section. And then here's a section for additional notes. This is an optional field. There's no red asterisks. So if you don't enter anything here, it's not a problem. The form will still allow you to submit. But I'm going to go up here before we try to submit and make sure I intentionally don't answer one of these questions to show you what happens. And maybe the tribal affiliation would be a good one. Well, I've got a couple of others here too. But so I didn't fill out all my required fields. I haven't entered referral information yet, but before I do, I have to submit this form. So now I click submit. And you'll notice it brings me back to the top of the screen here and shows me a number of fields that are required to be entered before it will allow me to submit the form. So age is required, zip code of clients required, location of the activity, fire department, and then tribal affiliation, which, as before I said, is not applicable if there's no applicable tribal association. Okay. Now I've entered everything it says that I was missing. And now I'm going to try to submit again. And I can enter a note here. Test notes here. And it lets me submit. Now, going to the next screen when you submit is really important. If you don't see the next screen populate, that means the form does not submit. Usually it does bring you to the top of the screen as we just saw. And then you can see right there what's missing. But in some situations, for some forms, sometimes it won't bring you all the way back there automatically. And you'll be clicking submit, but nothing will be happening. In those cases, you need to scroll up and see. if there's red text up there that says their piece is missing, and it'll tell you what you need to fill in. So here, this is add client referral. So we said that a client is being referred out. So now we go to this form, and it's got all these fields here that ask about the referral. So it says what's the date of the referral, the date the referral was made, what's the location, so you can say Catholic Church or something, service the client is being referred to. There's a drop-down list including other, and if you click other, as with other fields, there's an option here to fill out one. So substance abuse, the type of provider. So it can be some of these key providers that are associated with the SOR grant: office-based opioid treatment program, local governing entity, or other. And if we select other, again, of course, you have to enter that here. And then the name of the specific organization being referred to. I'm just entering in a possible provider. And then you click submit for that referral. Now, if there's only one referral and you click submit, then you're done. And you can navigate back to the dashboard, close out the system if you're done, that's fine. But if you refer the client to multiple referrals, you can enter in multiple referrals at one time by clicking this button, which is to reload form. Click it, the form appears again. And if I submit information once again, it's going to be associated with that same client. And it'll be linked together with that client and that client information in the data. So that's really important to keep in mind. However, there will be some situations where you may make a mistake or don't enter in all the client referral information you need to, and need to come back later to enter in that information again. And the next piece I'm going to walk through is how you'll go about doing that if you fail to enter in client information during the initial point that you submit the client information form and you're able to see this. So I'm going to walk through how it works first for the supervisors, and then I'm going to walk through how it works for the Crisis Mobile Team members, because they do function a little bit differently, but really they're very similar. And so if you follow the logic of one, you should be able to figure out the other one. But since I'm logged in as a supervisor now, I'll show you how it works for supervisor. For supervisors, you go down to View Edit Client Information. And you click this over, and here's a number of clients who have information that's been entered into the system. The first entry here is for the client that I just entered. So you see that long client ID, that 15-digit ID. For this case, the first thing that you do is click View Client Information Details. And you see all the information we've already entered is stored here. And this is an easy to view, easily accessible kind of form. When you scroll to the bottom of the screen, though, you'll see this client referral section. And when you see that, this is where you enter in the new information. You can view, edit, or delete that existing client referral. The edit and delete options are only available to the supervisors. Or you can enter in a new client referral by clicking this button here. So this is where you go. If I fail to enter in a client referral that I needed, I would go and do that right here. And here's where we see the same form we already saw. Referral date, location of referral, etc. Same information. And you can go back, click back to client information, or even click this button at the top of the screen or one of these links to go back and view other sections of the dashboard. And so I click back. Here I see this information again. That's where you'd enter new client information for someone who is a supervisor. So now I'll show you how this works for a Crisis Mobile team member who's not a supervisor. So we'll scroll out up to the top of the page and log out. And I'm going to log back in using credentials for someone else who's just, again, this is just a test case of a regular Crisis Mobile team member and not the Crisis Mobile team supervisor. And then you sign in there. And as I mentioned before, you see that these sections, the first section is exactly the same, but the second section is different because the edit and delete information is gone, and now it just says View History. So under the View History here, again, the logic is the same, the process is essentially the same, but it looks a little bit different. You click Client Information, And this test case is also associated with Region 1, so we see the same client. And anyone who uses the system for a given site will be able to see information for all the other information entered by anyone else in their site. You click View, and if I scroll down, here's where I am able to add client information. So I can view the client referral that was entered before, looking here. I can't edit it, I can't delete it, but I can see it. But if I need to enter in a new referral, I click back, you just type it into this actual screen. You don't click a new window to open. There's no other button. You just enter the information directly in here and submit. And then if I do, so I can just enter a test case here. Say this location was the police department. Not that you'd be referring people to the police department. We'll say you refer instead to a mental health provider. The service they're referred out to is behavioral health. The type of provider is a local governing entity, and these others they don't auto-populate if you select other, because the nature of the way this particular form works, they're automatically here. So if you have other, you just have to kind of remember to enter it. In the specific organization, we call it Dr. Smith, and then you click Submit. And then you see now the information is entered here as another referral out. And you can view it, and the other users here can view it as well. So that's the way these two systems work for entering client information, entering referrals, and adding extra referrals in. Please do view the other videos that are also going to be available to help explain the view edit process and the other forms as well. Though there are some very minor differences in terms of the way things may be described, essentially those forms work exactly the same way. They'll look exactly the same. So that guidance is going to be totally appropriate for you all and can help you understand how those other forms work. If you have any other questions, please refer to the user manual. That should answer most of those things, and we will be updating that manual periodically if we get information that requires us to do so. If that happens, you will be given access to the updated manual with highlights of where changes have been made. And if you have additional questions that are not answered through there, if it's a technical question related to the system, we have an email address that you can use that's listed in the user manual. That's SREC Data Hub at lsu.edu. And if it's a programmatic sort of substantive question, then you would contact people at the Office of Behavioral Health or your own supervisor at your site. Okay, thank you.